It's interesting how Washington has come up with so many different ideas of how oncology should be reimbursed. But the experiment, the Medicare or ASP experiment that's been proposed, or actually, I guess it's in a proposal phase, that's been proposed is really a focus on basically reducing what they pay oncologists for the care provided to patients, and without any that I can understand, any data that supports that there's value associated with that, without any understanding of the impact that might have, especially for practices like us who have rural locations in rural markets where Medicare is the only payer that the majority of our patients have. They don't have secondary insurances. They don't have supplemental insurances. And the ASP experiment, for many of the life-saving drugs that we provide, means that we couldn't buy them because our acquisition cost is higher than what the ASP experiment reimbursement would be. So it's not even really even a pass-through, if that was the intent, where what we buy and what we get paid is exactly the same. What we buy costs more than what we get paid, and it's impossible to make that work and be able to provide the life-saving therapeutics that we're, especially as I mentioned, in the rural locations where we have practices. You know, we're a big state in the state of Texas, and we have practices that are 90 miles apart, and some that are out where we're the only oncologist in the area, but where we serve populations that are challenged financially. And so the experiment is really going to, I think, have an impact on those kind of markets especially. All markets across the nation, but those kind of markets especially, and detrimental to access for patients to the care that they need.